Ever pondered what occurs when the common flow of intestinal contents hits a roadblock? Welcome to the fascinating yet intricate world of intestinal obstruction. This is a medical condition where the normal flow of intestinal contents is either partially or completely blocked. A crucial point to note is that this obstruction can occur anywhere in the gastrointestinal tract, which includes the small and large intestine. Now let's discuss the causes of intestinal obstruction. They can be broadly divided into two categories: mechanical and functional obstructions. Mechanical obstructions include factors like adhesions or scar tissue from previous surgeries, hernias, tumors, intussusception, and volvolus, which is the twisting of the intestine on itself. On the other hand, functional obstruction is often due to a condition called ileus, where there is a lack of coordinated contractions in the intestines. This can be triggered by surgery, inflammation, or infection. In the next segment, we will explore the symptoms of this condition. When intestinal obstruction occurs, it manifests in several noticeable ways. The first and often most prominent symptom is abdominal pain. This isn't your typical stomachache. It's a crampy, intermittent pain that comes and goes. Next, we have vomiting. But it's not as straightforward as it may seem. The vomit often becomes feculent, meaning it contains bowel content. An unpleasant thought indeed, but a key symptom to look out for. Abdominal distension, or swelling and bloating of the abdomen, is another symptom. This can be visually noticeable and often is accompanied by a feeling of fullness or tightness. Then there's constipation, characterized by the inability to pass stool or gas. This can be incredibly uncomfortable and is a clear sign that something is blocking the natural flow of the intestinal contents. Lastly, an absence of normal gurgling sounds in the abdomen or lack of bowel sounds can indicate an obstruction. Now that we've covered the symptoms, let's move on to how this condition is diagnosed. Diagnosing intestinal obstruction involves a combination of medical history, physical examination, and imaging studies. Indeed, the first step towards identifying an intestinal obstruction is understanding the patient's medical history and conducting a thorough physical examination. This involves assessing the patient's symptoms and looking for signs of obstruction such as abdominal distension and lack of bowel sounds. Next comes the crucial role of imaging studies. Why, you ask? Well, these allow doctors to visualize the blockage in the gastrointestinal tract. X-rays, for instance, can reveal areas of blockage or air fluid levels indicative of an obstruction. In some cases, a CT scan might be employed, offering a more detailed image of the intestines, allowing for a precise location and nature of the obstruction. In certain scenarios, an MRI might be used, though this isn't as common. Remember, these methods collectively provide a comprehensive picture of what's going on inside the body. After diagnosis, what's next? Treatment, of course. The treatment options for intestinal obstruction range from non-surgical management to surgical intervention. Non-surgical management may involve the use of a nasogastric tube. This tube, inserted through the nose and down into the stomach, can help decompress the stomach, relieving pressure and discomfort. Intravenous or IV fluids are another non-surgical treatment option. These fluids maintain hydration and electrolyte balance, crucial for overall health and recovery. In some cases, bowel motility agents can be used to stimulate the intestines and encourage normal functioning. If non-surgical treatments aren't sufficient, surgical intervention may be necessary. This can involve an exploratory laparotomy or laparoscopy, procedures that allow the surgeon to remove the obstruction or repair the underlying cause. It's important to understand that the choice of treatment depends on the specific cause and severity of the obstruction. However, like any other medical condition, intestinal obstruction can lead to complications if not properly managed. Untreated or severe cases of intestinal obstruction can lead to complications such as strangulation and perforation. Strangulation refers to the reduced blood flow to a section of the intestine, which can lead to tissue death. Perforation, on the other hand, involves a rupture of the intestinal wall, causing the release of intestinal contents into the abdominal cavity. Both complications are serious and can be life-threatening. The prognosis for intestinal obstruction largely hinges on early diagnosis and intervention. The quicker the blockage is identified and treated, the better the outcomes. Delayed treatment can lead to severe complications and increased mortality. In terms of prevention, steps can be taken to minimize the risk of adhesions during abdominal surgeries. Addressing conditions that may predispose individuals to obstruction promptly can also help prevent this condition. Remember, If you suspect intestinal obstruction or are experiencing related symptoms, seek medical attention promptly for a proper diagnosis and treatment.